Hello and welcome to NHIS in a Week. We bring you highlights of events within the authority and the scheme. My name is Vida Educhumwa Boateng. Now the headlines. Gambian delegation embark on a 4-day working visit to Ghana's NHIA. NHIA registers patrons at this year's Riverfest. NHIA's Raymond Avinu crowned Ghana's 2022 Best Administrator. A 5-member delegation from the Gambian National Health Insurance Scheme has completed a 4-day working visit to the National Health Insurance Authority here in Accra. The purpose of the visit was to learn the rudiments of managing and sustaining a national health insurance scheme such as the NHIS in Ghana. For a country that is just starting off its national health insurance policy, the leader of the delegation and CEO of the Gambia Health Insurance Scheme, Mr. Bai Mas Singh, indicated that his country is proud to model its health insurance scheme around that of Ghana, owing to Ghana's 19-year-long success of providing medical insurance cover for its residents.
We chose Ghana as a center of excellence to come and understudy and benchmark because Ghana and Gambia have had a long-standing relationship of collaboration, and even the Act, the National Health Insurance Act, was modeled according to the Ghana NHIS Act. So we thought that there is a lot of good practice we can learn from here, migrate best practices, go to Gambia and implement. And when we came, we were not disappointed. Our people we interacted were very detailed in their explanation, and every area that we visited, we learned a lot, and all the explanations were so clear that we didn't regret choosing Ghana.
The NHIS TV crew spoke to a member of the Gambian delegation.
So it has been amazing, and I've learned a lot that I will take home with me and hope to build a better relationship with everyone in the NHIS Ghana. It will be a straight adaptation but we kind of have differences in the way we set up from the Ghanaian way. Like, for instance, our main, yours is informal and SNIT, which is the social security, and ours will be informal and payroll. So it's kind of different on that aspect. So I wouldn't take that aspect with me, but the rest of the information is almost all the same. And I've seen the work in hand, so I will obviously take everything with me. I'm not leaving anything here.
The National Health Insurance Authority has participated in this year's Riverfest. Riverfest 2022 is an officially endorsed event that is part of the Beyond the Return initiative organized by the Ghana Tourism Authority. It is an annual festival curated to celebrate and propagate the socio-economic and cultural affairs of Ghana. The 3-day event had participants from the diaspora, including revelers from Ghana. The Ada NHIS District Office, in collaboration with the Corporate Affairs Directorate, took advantage of the festival to promote the newly launched My NHIS app, and also used the opportunity to register patrons onto the scheme. Here are some highlights of the event.
Yeah. I think that, we're happy that NHIS is here. It's a national health insurance scheme. And so I think going beyond the conventional ways of getting people onto the scheme is very laudable. Especially during this festive season when we're going to have a lot of people going to events. Once we have an NHIS stand at an event, it encourages people to ask questions, clear all kinds of myths about NHIS, and register, and get onto the scheme, because the scheme is good for all of us. You never know where you may find yourself. So it's very important that we get as many people as we can onto the scheme, especially our parents, our children, our loved ones, friends, and family. So I think that is a good thing. I'm happy that NHIS found the time to set up here and they're educating people about it. I'm very happy about that.
So according to the organizers of the program, the target is for the diasporans who are coming home to celebrate the festive period to engage with each other. So we as a scheme or authority also take advantage of this opportunity to also engage with them. What are we engaging them for? We are making sure that they have NHIS whilst they are in Ghana. And we are making sure that their families who are in Ghana here are also enrolled onto the scheme. Some don't even know about the scheme. So we are also educating them and creating awareness for them to know that the scheme exists and the scheme is really working and working well.
Moving on, the Acting Director of Administration for the authority, Mr. Raymond Avinu, has been adjudged Ghana's best performing administrator for the year 2022 at the just-ended Ghana Leadership Awards ceremony in Accra. Presenting the award, Chairman for the Commission, Osaberi Makwesi Atta II, congratulated Mr. Raymond Avinu for his outstanding performance in office. Mr. Avinu received the prestigious award with satisfaction and commended the NHIA Governing Board, Executive Management and all staff for their steadfastness and cooperation in the discharge of his duties. He equally thanked the event organizers for the honor and renewed his commitment and service to the NHIA and Mother Ghana, which is riding on the back of the NHIS to achieve universal health coverage by the year 2030. Up next is NHIS Titbits.
Did you know that a member of the scheme who defrauds or attempts to defraud the scheme by conniving with a healthcare provider, NHIS staff or any other person or persons to make a claim for a service which has not been provided, a service which the member does not need but which the healthcare provider purports to have provided, a medicine prescription which the member does not require or which is more than what the member requires, or indulges in any other fraudulent or dishonest act, commits an offense punishable under the law.
This week on Health Tip, we take a look at glaucoma. This is how we wrap up this week's edition of NHIS in a Week. For details of these stories and more, do log on to our website www.nhis.gov.gh or follow us on our social media platforms displayed on our screens. My name is Vida Educhumwa Boateng. Thanks for watching.